I posted a video celebrating the American College of Obstetrics and Gynecology, or ACOG, update on cervical cancer screening guidelines, which now recognizes a speculum-free option as an alternative for conventional Pap testing. I think it's worth taking a look at the history of the Pap smear, and then you can decide how you feel about it and what you would do for your own screening if you have a cervix. The Pap smear is named after Dr. Papanicolaou, an American gynecologist who showed that sampling from the vagina could identify cancer cells that had exfoliated from the cervix. If you read his original paper from 1941, you will see that he clearly describes using a pipette to sample fluid from the posterior vaginal fornix. A pathologist, Dr. Ernest Eyre, subsequently showed that collecting directly from the cervix with a wooden spatula provided better sampling of the cells to study under a microscope. But it wasn't until the 1980s that Dr. Harold Surhausen showed that HPV is the causative virus behind this terrible cancer. This knowledge led to the development of tests for the causative HPV strains, and ultimately the incorporation of DNA-based HPV testing into screening guidelines. Now, even if you don't go looking up old science papers in your spare time like some weirdo, you probably are aware from forensic science shows and the existence of 23andMe that DNA testing has improved tremendously over the past decades. DNA amplification allows even small signals to be picked up with modern technology. So why can't we apply this technology to make women's health screening accessible to more people? In fact, randomized controlled trials have shown that HPV testing is more sensitive for detecting cervical precancers and cancers than Pap alone. This is why the American Cancer Society has recommended primary HPV testing instead of Pap since 2020. People have written on my social media about how their SA history or pain from a violently done Pap in the past led them to stop screening or even to stop seeing doctors at all. These patients deserve options, so thank you, ACOG, for recognizing one.